An anal fistula is a communicating tunnel that connects the inside of the anus with the outside skin around the anus. This thin tunnel often transects the internal sphincter muscle, responsible for passive continuous anal tone, and the external skeletal muscle sphincter, responsible for voluntary squeeze tone. Both sphincters are important for maintaining fecal continence. A fistula arises when an anal abscess ruptures both externally and internally. A seton is a thin silastic tube that can be inserted into the fistula tract to allow it to fully drain and to allow the inflammation and infection to settle. Then sometime later, proper assessment of the fistula can be performed to determine the height of the internal opening and the amount of internal sphincter involved. For a low fistula where the internal opening is less than a third of the height of the sphincter, the fistula can be successfully laid open without risk of incontinence. This converts the fistula into a superficial ulcer that gradually heals over the next 6 to 12 weeks with a very high success rate. This can be performed as a day-stay procedure. If the internal opening is high and involves more than a third of the internal sphincter muscle, then it is not safe to lay open this fistula, as there is significant risk of passive fecal incontinence. Therefore, for a high fistula, a seton is inserted for quite some time, often more than 6 months, to allow the tract to mature and epithelialize. This seton can be left in indefinitely or can be removed with a formal surgical excision and repair performed. This is a 1 to 2 hour operation that requires hospitalization for several days. After your fistula surgery, you will need to wear a pad, as some discharge is to be expected. Warm to hot sitz baths are soothing and cleanse the wound. Notify your doctor if sudden swelling, warmth, and pain develop, as this may indicate infection.